This video is developed by MedStud. This is an educational guide for the interpretation of electrocardiogram. First of all, let's clear a common confusion regarding the terms electrocardiogram and electrocardiograph. Electrocardiogram is the graphical interpretation of the electrical activities of the heart, whereas electrocardiograph is a machine which is used to take the reading of a subject. We have to read the ECG systematically following several steps, which involves analysis of the heart rate, the rate of atria and the rate of ventricles. Then we should analyze the rhythm. Is it regular or irregular? Following the rhythm, we must analyze the P waves. Are there prominent P waves for every QRS complex? And is there a QRS complex for every P wave? Next, we have to analyze the PR interval. Is the interval less than 0.2 seconds? That is less than one big box. Lastly, we'll analyze the QRS complex and check if it's less than 0.12 seconds. That is less than 3 little boxes. Before we know what is abnormal, let's have a look at what is normal. Now, let's follow the steps we just mentioned. Let's analyze the rate. To measure the heart rate, we must measure the RR interval. Here, there are 4 complete big boxes and nearly half box. To find out the heart rate, we must divide the number of big boxes from 300. So, that makes the heart rate nearly 66. Now, let's analyze the rhythm. Is it regular or irregular? Again, let's measure the distances between R waves. This time, we will keep in mind the distance between successive R waves, if they are same or not. Here, we find that successive R waves are at equal distance, so there is normal rhythm. Next, let's look at the P waves. Do we have a P wave for each QRS complex? There is a P wave and a QRS, another P wave and a QRS, a P wave and a QRS. Yes, we see a P wave before each QRS complex. Now, the PR interval. Is it less than 0.2 seconds? That is less than one big box? Yes, it is. Lastly, let's look at the QRS complex. The QRS complex, in order to be within normal parameters, needs to be less than 0.12 seconds, that is less than 3 little boxes. So here, we have normal QRS complex. Can you identify this rhythm? See the rate, rhythm, P waves, PR interval, and QRS complex. The number of big boxes are nearly 5.5. So, the heart rate is about 55, which is very less than normal. This wave represents sinus bradycardia. The same way you can figure out sinus tachycardia, analyzing the heart rate, rhythm, and PR intervals. Can you identify this rhythm? See the rate, rhythm, P waves, PR interval, and QRS complex. Here we have irregularly irregular rhythm with no distinguishable P waves. This is atrial fibrillation. Remember, P waves are associated with atrial contraction. So, any variation in P waves indicates atrial abnormality. Can you identify this rhythm? See the rate, rhythm, P waves, PR interval, and QRS complex. Atrial flutter is a dysrhythmia with funky-looking P waves and extremely fast heart rate. Remember, the F for funky-looking P waves indicate flutter. Can you identify this rhythm? See the rate, rhythm, P waves, PR interval, and QRS complex. Are the waves indicated by the arrows P wave or T wave? Due to the fast rate, the P wave is mixed with QRS complex, so the wave indicated by the arrows are T waves. How do you know that it's supraventricular? Because of the narrow QRS complex, which are less than 3 little boxes. So, this is supraventricular tachycardia or SVT. This is a special kind of supraventricular tachycardia. Notice that at first the rate is normal, but just for a few seconds it got tachycardic suddenly. Suddenly means paroxysmal. So this wave is paroxysmal supraventricular tachycardia or PSVT. Look at the rate, rhythm, P waves, PR interval and QRS complexes. What do you see? The number of big boxes between RR interval is just a bit greater than 3. So, the heart rate is around 90. Now, the rhythm. The R waves seem to be regularly spaced. So, this is a regular rhythm. Let's look at the P waves in leads 2 and 1. In lead 2, the P wave is seen clearly in the shape like M. The notch of the M in P wave is greater than 3 little boxes. The M represents mitraly, a disorder of the mitral valve. It may represent mitral regurgitation or mitral stenosis. Look at the rate, rhythm, P waves, PR interval and QRS complexes. What do you see? The number of big boxes between RR intervals is nearly 4. So, the heart rate is around 75. Let's look at the rhythm. It's regular. Look at the P waves, they're non-existent or short. In lead 2, there is a delta wave in the QRS complex. All these indicate WPW or Wolff-Parkinson-White syndrome. It is a syndrome of pre-excitation of ventricles due to an accessory pathway known as bundle of Kent.